My name is Peter Clark. I'm a consultant medical oncologist at Clatterbridge Centre for Oncology, which is based in Merseyside. There are 4 different types of chemotherapy. So first of all, there's curative chemotherapy, and that is easy for everyone to understand. You're trying to cure the patient of that particular disease, and cure means the fact that they will live a normal life after the end of treatment. And palliative treatment is where you cannot cure the cancer. You are trying to make the quality of life as good as possible for as long as possible, whether it be for a few months or for a few years. Adjuvant chemotherapy is given to patients where you are trying to reduce the risk of the cancer coming back in the long run. This is seen in cases where patients have usually had surgery, where all the cancer has been removed as far as you're aware. Neoadjuvant chemotherapy is treatment given to patients where you are trying to improve the results of surgery or radiotherapy. Another form of chemotherapy is given with tablet chemotherapy.
At first it was quite scary, and certainly when I came for my first treatment I was unsure as to what was going to happen. I'm actually having 2 kinds of chemotherapy, one which I come into the hospital for and have a drip, and then I take some tablets at home for 9 days. And then I have 5 days when I don't have anything. I've got a hot pad on my arm because one of the things that happens with this particular chemotherapy that's being going in with the drip is that it can make your arm quite cold, your vein quite cold. So I've got a hot pad on, and I have to say it's wonderful. I don't want anybody to take it off.
The hurt from chemotherapy comes in terms of pain from the needle being popped into the vein. Now this is just the same discomfort as you would get with a blood test. So the hurt from chemotherapy, whilst it clearly can never be ignored, isn't a major part of the chemotherapy experience, because once the needle is in the vein, whether it's for 5 minutes or for 5 days, it doesn't hurt once it is in. It is the side effects of chemotherapy that are clearly much more significant in terms of affecting the quality of a patient's life. And that is why throughout chemotherapy we do all our best to minimise these. Your typical chemotherapy agent will certainly cause tiredness. There is a risk of sickness, but there are very good anti-sickness drugs these days that can control that. Chemotherapy frequently causes taste change. It can cause a sore mouth. The first side effect that many people ask about, however, is hair loss, and this is variable because there are some chemotherapy drugs that always cause it. There are some chemotherapy drugs that virtually never cause it, and there are some drugs that variably cause it.
While I've been on the chemo up to now, but no side effects whatsoever. I was very apprehensive at the first, thinking of who's going to get problems, but I've had no problems. I'm usually in for half a day while I have my treatment. It's nice to have somebody with you while you're in here.
I think it is fair to say that everyone is scared when they first come for chemotherapy, because they're faced with a potentially life-threatening disease such as cancer. They're faced with a treatment that they are unfamiliar with, and we all know that the side effects are variable. Coming with a family member is always a good idea, because it's someone who can share the anxiety with people, and it's someone that can also relay to other family members exactly what's happened.